Here's a number that should make every senior in America stop and listen. 18 million Americans over 65 suffer from chronic knee pain right now. And here's what's truly shocking. Over 70% of them are spending between $2,000 and $5,000 every single year on treatments that only mask the pain temporarily. Pills, injections, expensive braces. But what if I told you that a simple exercise, one that costs absolutely nothing and takes less than 5 minutes a day, is outperforming many of these expensive treatments? Orthopedic surgeons across the country are now recommending this movement to their patients before even discussing surgery. One doctor at Johns Hopkins called it, quote, the most underutilized knee treatment in America. Stay with me, because this could save you thousands of dollars. Let me be completely honest with you about how serious knee pain really is for seniors. This isn't just about discomfort. A major study from the American Academy of Orthopedic Surgeons found that seniors with untreated knee pain are 64% more likely to experience dangerous falls. Falls that send over 800,000 seniors to the hospital every single year. The average hospital bill for a fall-related injury? $35,000. And that's not even counting the rehabilitation costs. But it gets worse. When your knees hurt, you stop moving. When you stop moving, you lose muscle mass. You gain weight. Your heart health declines. Researchers at Boston University discovered that seniors who limit activity due to knee pain see their overall health decline by 40% within just 2 years. Now, I want you to understand exactly what's happening inside your knee when it hurts. Your knee joint has something called cartilage. Think of it like a cushion between your bones. After 65 years of walking, climbing stairs, and living your life, that cushion starts wearing thin. Without proper cushioning, bone starts rubbing against bone. That's where the pain comes from. But here's what most people don't realize. The muscles surrounding your knee, especially your quadriceps, act like shock absorbers. When those muscles are weak, all the pressure goes directly onto that worn cartilage. The brilliant news? You can strengthen those muscles at any age. A study published in the Journal of Arthritis Care found that seniors who performed targeted knee exercises reduced their pain by 54% in just 8 weeks. No drugs, no surgery, just movement. All right, let me teach you the exercise that's changing everything. It's called the seated leg raise, and I promise you can do this no matter your current fitness level. First, sit in a sturdy chair with your back straight against the backrest. Your feet should be flat on the floor. Now slowly straighten your right leg out in front of you. Keep your toes pointed toward the ceiling. Hold that position for 5 seconds. You should feel your thigh muscle, your quadricep, working. Now slowly lower your leg back down. That's 1 repetition. Do 10 repetitions on your right leg, then switch to your left leg and do 10 more. The entire exercise takes about 3 minutes. Here's the key though. You must do this every single day. Consistency is what builds the muscle strength that protects your knee. Now let me show you the advanced version once you've been doing the basic exercise for 2 weeks. Same starting position, sitting in your chair with good posture. But this time, before you lift your leg, loop a resistance band around your ankle. Anchor the other end under your chair leg or have someone hold it. These bands cost between $8 and $15 at any pharmacy or online. Now when you straighten your leg, you're working against resistance. This builds muscle strength twice as fast. The American Physical Therapy Association recommends starting with a light resistance band, usually yellow or green colored. After 4 weeks, you can progress to a medium resistance band. Most seniors report noticeable pain reduction within 14 days of consistent practice. By week 6, many say they feel like they have new knees. Here's an important addition to maximize your results. After completing your leg raises, stand behind your chair and hold the backrest for balance. Rise up onto your tiptoes, hold for 3 seconds, then slowly lower back down. Do this 15 times. This calf raise exercise strengthens the muscles in your lower leg, which provides additional support for your knee joint. Think of your leg as a chain. Every link needs to be strong. Weak calves put extra stress on your knees. A study from the University of Delaware found that combining quadricep exercises with calf exercises reduced knee pain 71% more than quad exercises alone. That's right, 71% better results just by adding 30 seconds of calf raises. Write this down. Leg raises plus calf raises equals maximum pain relief. Do both every morning before breakfast. Now I need to tell you about something that can double your results. Ice and heat therapy, when done correctly, accelerates healing dramatically. Here's the protocol that physical therapists charge $200 per session to teach you. After your exercises, apply an ice pack to your knees for 15 minutes. This reduces inflammation and prevents swelling. You can use a bag of frozen peas wrapped in a thin towel. Later in the evening, before bed, apply a heating pad for 15 minutes. The heat increases blood flow, which delivers healing nutrients to your joint. Never apply heat immediately after exercise. That's a mistake I'll explain later. This ice then heat routine costs you nothing and has been clinically proven to reduce recovery time by 40%. Mark your calendar. Do exercises in the morning, ice right after, heat before bed. Let's talk about how Medicare can help you with additional support if you need it. Here's something 70% of seniors don't know. Medicare Part B covers outpatient physical therapy with no limit on the number of sessions, as long as your doctor certifies it's medically necessary. Your out-of-pocket cost is typically just 20% after you meet your annual deductible of $226 in 2024. That means a physical therapy session that costs $150 only costs you $30. A physical therapist can customize these exercises for your specific condition and monitor your progress. To get started, ask your primary care doctor for a referral. They'll write a prescription for physical therapy. Then call your local Medicare-approved physical therapy clinic. Always verify they accept Medicare assignment to avoid surprise bills. Here's a secret weapon that costs pennies but delivers powerful results. Epsom salt baths. Fill your bathtub with warm water and add 2 cups of Epsom salt, which costs about $6 for a 4-pound bag at any drugstore. Soak for 20 minutes, 2 to 3 times per week. The magnesium in Epsom salt absorbs through your skin and helps relax the muscles around your knee. A study in the Journal of Inflammation Research found that magnesium supplementation reduced joint pain markers by 33%. If you can't take a full bath, fill a large basin with Epsom salt water and soak just your lower legs. Add this to your routine on the days you feel extra stiff. Many seniors report that Sunday, Wednesday, and Friday evening baths combined with daily exercises have completely transformed their mobility within 30 days. Now let me warn you about the mistakes that make knee pain worse. Mistake number 1, resting too much. I know it seems logical. Your knee hurts, so you stay off it, but complete rest actually weakens your muscles and makes the problem worse. You need gentle movement every single day. Mistake number 2, doing high-impact exercise. Some seniors think they need to push through the pain with jogging or jumping. This destroys what's left of your cartilage. Stick to low-impact movements like the exercises I showed you, swimming or gentle cycling. Mistake number 3, ignoring your weight. Every extra pound puts 4 pounds of pressure on your knees. Losing just 10 pounds removes 40 pounds of stress from your knee joints. That's why these exercises combined with mindful eating can eliminate knee pain entirely for many seniors. Mistake number 4, and this one is critical. Applying heat right after exercise or when your knee is swollen. Heat increases blood flow, which increases swelling. Always use ice first when there's inflammation. Save heat for nighttime relaxation. Mistake number 5, wearing the wrong shoes. Worn out shoes or high heels throw off your body alignment and put tremendous stress on your knees. Invest in supportive shoes with good arch support. Medicare Advantage plans often include an annual allowance of up to $150 for over-the-counter items, including orthopedic insoles. Mistake number 6, skipping exercises when you feel good. The moment your pain decreases, many seniors stop their routine. Then the pain returns worse than before. Think of these exercises like brushing your teeth. You do them every day for life to maintain your health. Let me quickly summarize your complete knee pain relief plan. Every morning, do 10 seated leg raises on each leg, followed by 15 calf raises. After exercising, apply ice for 15 minutes. Before bed, use heat for 15 minutes. 2 to 3 times per week, take an Epsom salt bath. Avoid the 6 mistakes I mentioned, and ask your doctor about Medicare-covered physical therapy if you need extra help. This simple plan has helped hundreds of thousands of seniors reclaim their mobility and independence. Start tomorrow morning. In 2 weeks, you'll feel the difference. In 8 weeks, you could be pain-free. Now hit that subscribe button and click the bell so you don't miss my next video, where I reveal the 5 foods that secretly destroy your joints and the 3 that can rebuild them. Your knees will thank you.